Good morning to all. I am Professor Manavalam. Now we are going to discuss about the case study presentation.
Good morning. Today we are going to see an interesting topic as a case presentation. It is one of the topic we studied. Some of you studied in pediatrics, and again we are going to revise this condition as a case study presentation. This is an imperforate anus. It is one of the congenital malformation. It is commonly seen in the newborn babies. It is most common for the male babies when compared with the female babies. It is most common congenital malformation we are frequently seeing in the hospital settings. So today Ms.Ranisha, finally a BSc Nursing student, going to explain the imperforate anus through case study presentation. Then we see about the condition.
Good morning, ma'am. Good morning, students. In previous classes, our classmate Ramsana has taken a class about congenital malformations. Now, what do you all know about congenital malformation?
Anyone raise up and answer the question. What is congenital malformation?
Developmental delay present at the birth.
Developmental delay present at the birth. Okay, very good.
So, congenital malformations are the birth defects that can occur both structurally and functionally and are present at birth or during the development of fetal development. So, they can be identified before, at and after birth and can range from minor to severe conditions. Okay, this is a sample of case scenario. A full-term male infant was born via normal vaginal delivery with no complications during pregnancy. Within 24 hours of birth, the baby had not passed meconium. The mother reported that the baby appeared uncomfortable and had a swollen abdomen. On examination, the nurse noticed there was no visible anal opening in the perineal area. A small amount of meconium was seen coming from the urethra. The baby had difficulty in feeding and mild vomiting. What may be the diagnosis? It is imperforate anus. Imperforate anus is a congenital malformation in which anal opening is absent, abnormally located or blocked, preventing normal passage of stool. So it can be a blunt end of rectal pouch or abnormal fistula or abnormal connection with the bladder or vagina. And it is a part of anomalies known as anorectal malformations and often require surgical correction shortly after birth. Now I request Latarani to come and say about classification. Here, Latarani. Classification.
Turn towards this one.
Types: low type, intermediate, high type.
So there are three major types in imperforate anus, that is high, intermediate and low. And in high, it is differentiated into male and female. Imperforate anus are broadly classified into three types: high, intermediate and low. So Ramsana, can you come
Someone,
Causes and risk factors usually develop during the 5th to 7th week of pregnancy. Exact cause is unknown, may be associated with genetic syndrome or environmental factors.
So the cause of imperforate anus is still unknown, but it may be associated with some genetic and chromosomal influences like trisomy 18 and trisomy 21. So, and it may be associated with VACTERL conditions, that is vertebral, anorectal malformations and renal and limb abnormalities. Then coming to the pathophysiology, during normal embryogenesis, the cloaca divides into urogenital sinus and anorectal canal. So failure of this division or improper descent of the urethral system result in imperforate anus. This cloaca membrane during between 4th and 7th gestational period, this will divide into urogenital sinus as well as the anal canal. So the failure of this division during the gestational period, it may be any other cause, genetics or chromosomal abnormalities. Due to the variations, this failure will appear, leading to the imperfect anus. So the rectum may end blindly, or it may have abnormal connection causing leading to fistula. And obstruction that leads to obstruction of the meconium passage, leads to abdominal distension and vomiting, that leads to imperforate anus. Then coming to the clinical manifestations, we already seen that the rectum will end blindly, or it may be in abnormal connection with the bladder. So there will be no visible anal opening, and abnormal distension will be appear. Then passage of meconium through the abnormal openings. It may be through the urethra or vagina in females. And vomiting may occur. It may be in bilious green color in nature. And fever, lethargy, poor feeding, and symptoms may be associated with VACTERL and failure to pass meconium within 24 to 48 hours. This is the main symptom that we can notice in the imperfect anus. And coming to the diagnostic evaluation, Ms. Dhoni, can you tell me?
Physical examination at birth, abdominal X-ray, MRI, abdominal ultrasound.
So the more diagnostic evaluations will be physical examination, abdominal X-ray, ultrasound abdomen and pelvis, MRI and CT scan, Voiding cystourologram, gloved finger examination, cholecystogram, cardiac evaluation and spinal fluids. Then coming to the management, medical, surgical as well as nursing management. So the medical management will be NBO status, nil per oral, and empty tube insertion, administration of IV fluid and electrolytes, measurement of abdominal girth and urine output, administration of antibiotics, analgesics and antipyretics. And coming to the surgical management, cruciate incision, manual dilations in anal stenosis, anoplasty, divided sigmoid colostomy, posterior sagittal, anorectoplasty. And coming to the nursing management, gastric decompression by empty tube, observe vital signs and administration of IV fluid, prevention of infection, colostomy care, stoma area should be kept and clean, monitor anal dilation and teach adequate hygienic measures. This is all about imperforate anus.
So everyone clearly understood about the imperforate anus. Imperforate anus. Actually, it is if we are diagnosing very early period. So immediately after birth of the baby, by doing every pediatrician usually do the physical examination, whole body examination. So they initially found the congenital malformation, means it is very easy to treat the baby. We can prevent the complication that occurs in later period of time. So immediate diagnosis and treatment is giving the well prognosis in case of imperforate anus. Apart from that, the baby undergone any kind of surgical management, the continuous nursing management and home care management is playing very crucial part in the prognosis of the newborn. Are you clear? Okay. Thank you all.
Thank you.